For decades, we've looked at weight loss surgery all wrong. We thought it was just plumbing, but brand new data from an 8-year clinical trial just revealed something terrifying and beautiful about what fat actually does to your mind. Welcome back to Clinical Trials Explained, where we read the dense, impossible to understand medical science so you don't have to. Today, we are talking about the brain. Specifically, we are talking about the brain on severe obesity. We all know the standard warnings about carrying extra weight, right? Heart disease, joint pain, type 2 diabetes. But over the last decade, a whisper started making its way through the neurology community. Doctors began noticing that patients with a body mass index over 35 weren't just suffering physically, they were suffering cognitively. Memory scores were slipping. Executive function, the part of the brain that makes complex decisions and controls impulses, was slowing down. People were describing a thick, suffocating mental fog. So scientists at the University of Florida asked a radical question. If severe obesity is actively damaging the connections in the human brain, what happens if we force massive, rapid weight loss using bariatric surgery? Does the brain stay broken, or does it heal? To answer this, they launched the WISE Brain Study, a clinical trial. They took 197 people, shoved them into MRI machines to look at the wiring of their brains, and then tracked them for 18 agonizing months. And the results, which were just finalized and posted, completely rewrite everything we know about weight loss, human metabolism, and human memory. By the end of this video, you will never look at body fat or brain scans the exact same way again. To understand why this study is so revolutionary, we have to take a journey deep inside the human skull. Imagine your brain is a sprawling, hyper-modern city. You have different districts. You have the frontal cortex. Think of this as the CEO's office. It's located right behind your forehead. This is where you make decisions, plan for the future, and control your impulses. Then you have the hippocampus. This is deep inside the brain. Think of the hippocampus as the city's master librarian. It catalogs your memories, helps you learn new things, and keeps a record of who you are. For your city to function, the CEO and the librarian need to talk constantly. They are connected by a massive, high-speed fiber optic network. Information zips back and forth in milliseconds. But what happens when someone develops severe obesity? For a long time, the medical world thought fat was just stored energy, like a spare battery, just sitting there, doing nothing. We now know that is completely 100% false. Adipose tissue, especially visceral fat that gathers around the organs, is biologically active. It is an endocrine organ, and when you have too much of it, it becomes stressed. It starts panicking, and it starts pumping out inflammatory chemicals called cytokines. These cytokines flood into your bloodstream. They travel up to your neck, and they cross the blood-brain barrier. Suddenly, your brain city is under siege by systemic inflammation. But that's not all. With severe obesity often comes type 2 diabetes, or at least severe insulin resistance. Your brain is an energy hog. It weighs about 2% of your body weight, but uses 20% of your energy. It needs glucose to survive. But when you become insulin resistant, the cells in your brain can't absorb the sugar efficiently. Scientists literally call this type 3 diabetes. The neurons are starving in a sea of plenty. So, between the inflammation fires burning in the streets and the energy shortage, the high-speed fiber optic cables between the CEO and the librarian start to fray. The signals get weak. There is static on the line. The CEO asks for a memory, and the librarian takes too long to answer. This is the biological reality of brain fog. It is a physical disconnection of brain networks. Historically, what have we done about this? Well, we've told people to just eat less and move more. But if you have a BMI over 35, the hormonal signaling in your body is fundamentally broken. Your ghrelin, the hunger hormone, is screaming at you. Your leptin, the fullness hormone, is being completely ignored by your brain. You have leptin resistance. Diet and exercise, while incredibly important, have a notoriously high failure rate for Class 2 and Class 3 obesity. Back in the day, weight loss surgery was barbaric. In the 70s and 80s, they used to just wire people's jaws shut. Then we moved to gastric bypasses and sleeve gastrectomies. Initially, surgeons thought, hey, we are just making the stomach smaller. A smaller tank means less gas, which means the car loses weight. But then, patients started reporting something weird. Days after the surgery, before they had even lost a significant amount of weight, their diabetes would vanish. Their blood sugar would normalize. We realized bariatric surgery wasn't just a mechanical restriction, it was a metabolic reboot. Changing the plumbing of the gut completely changed the hormones rushing to the brain. It altered GLP-1 levels. It reset the system. But Dr. Ronald Cohen and his team at the University of Florida realized nobody was looking at the actual hardware of the brain. Sure, the blood sugar was better, but what happened to the frayed fiber optic cables? Did the CEO and the librarian ever start talking again? That brings us to the actual design of the WISE Brain trial. Setting up a clinical trial like this is a logistical nightmare. It's not a drug trial where you just hand out pills. They needed two specific groups. Group 1, 150 participants who were already scheduled to get bariatric surgery for weight loss. Group 2, 47 community volunteers. These were healthy adults who also had a BMI over 35, but who had chosen not to undergo surgery. This is the control group. To be in this study, participants had to be compatible with an MRI machine, which, if you've ever had an MRI, you know is no joke. It is a loud, claustrophobic, magnetic tube. They laid these patients down, slid them into the scanner, and performed something called a functional MRI, or fMRI. Let me explain how genius this is. A regular MRI just takes a picture of your brain's structure, like a photograph of a house. But an fMRI measures the BOLD signal. BOLD stands for blood oxygen level dependent. It acts like a thermal camera for brain activity. When a specific part of your brain works hard, it needs more oxygen. Blood rushes to that area. The fMRI can see this rush of blood in real time. By looking at the BOLD signals, scientists can measure something called functional connectivity. They pick a seed point, let's say the right hippocampus, our librarian, and they look at the rest of the brain to see which areas are lighting up at the exact same time. If the frontal pole, the CEO, lights up in perfect sync with the hippocampus, it means they are functionally connected. They are talking. If the correlation coefficient is 0, it means they are disconnected. They are acting like strangers. So, they scanned all these patients. They took baseline blood draws to check for inflammatory markers and blood sugar, and then they sent them home. The surgery group went to the hospital, went under general anesthesia, had their digestive tracts surgically altered, and began the brutal, painful, life-changing journey of massive weight loss. The control group went back to their normal lives. And the researchers waited for 18 months. Let's pause here to look at the participant flow, because this is where the reality of clinical trials sets in. Out of the 150 people who started in the surgical group, only 76 completed the 18-month overall study. Why? Because real life happens. But eventually, after 18 months, the researchers called the remaining patients back. They had lost incredible amounts of weight. Their blood work had fundamentally changed. And 37 specific individuals, 20 from the surgery group and 17 from the control group, were slid back into the fMRI machine for the ultimate test. This is the moment of truth. Did the weight loss fix the brain? The scientists booted up the computers and looked at the Fisher-Z transformations. This is a statistical way of scoring the strength of the brain's connection. A value below 0 means the connection is weakening. A value above 0 means it's strengthening. Let's look at the data. First, they checked the left hippocampus to the frontal cortex. At baseline, before surgery, the surgical group had a score of 0.09, a weak, static-filled connection. 18 months after surgery, the score leaped to 0.16. Let's look at the right frontal pole, the decision-making center. Baseline before surgery, 0.07, barely a whisper. 18 months after surgery, 0.21. A massive, roaring signal. But it gets crazier. Let's look at the right inferior frontal gyrus. This is the part of the brain responsible for cognitive control, impulse inhibition, and risk evaluation. It is the brake pedal for bad decisions. Before surgery, the connection score was 0.12. 18 months after surgery, it skyrocketed to 0.24. In another cluster, it went from 0.22 all the way to 0.34. What about the control group? The people with BMI over 35 who didn't get the surgery? Their brains essentially flatlined or degraded. Their right frontal pole connection went from 0.10 down to 0.03. Their left hippocampus connection dropped below 0 to negative 0.03. The connections were literally rotting away while the researchers watched. The researchers ran a 2x2 factorial ANOVA statistical analysis. The p-value was less than 0.01. In the world of science, this is a mic drop. It means there is less than a 1% chance this was a fluke. The bariatric surgery didn't just help these people fit into smaller clothes. It rapidly reduced systemic inflammation. It eliminated the insulin resistance in the brain. It cleared the wreckage out of the fiber optic network. And as a result, the brain literally rewired itself. The CEO and the librarian got their high-speed internet back. The areas of the brain controlling memory, decision-making, and emotional regulation woke up from a chemical coma.
So why does this matter to you? Why does this 18-month trial from Florida change how we view medicine? Because for decades, society has treated obesity as a moral failing. We have looked at people struggling with severe weight and blamed a lack of willpower. But this fMRI data shows us the invisible war happening inside the skull. When your adipose tissue is chronically inflamed, it chemically unplugs the very parts of your brain you need to make good decisions. The impulse control center loses power. The decision-making center is disconnected. Telling someone with class 3 obesity to just use willpower is like telling someone with a broken leg to just run faster. The biological hardware required to execute that command is compromised. But the beauty of the WISE brain study is the message of profound hope. The brain is plastic, it is resilient, it wants to heal. When the toxic load of massive excess weight is removed, whether that is through bariatric surgery or the new wave of GLP-1 medications like Ozempic and Mounjaro that are mimicking these surgical metabolic effects, the brain doesn't just stop declining, it rebuilds. It rebuilds the bridges, it lays down new cables, it restores your cognitive power. This means weight loss isn't a vanity project, it is neuroprotection. It is how you protect yourself from cognitive decline, dementia, and memory loss as you age. It is how you get your mind back.
The medical world is advancing at a terrifying, exhilarating speed. We are moving past the dark ages of diet culture and entering the era of metabolic neurology. If this study blew your mind, you need to hit the subscribe button right now. Here at Clinical Trials Explained, we don't do hype. We tell the actual trial protocols, we analyze the raw data, and we bring you the truth about the future of human health. I want to hear from you in the comments. Have you or someone you know experienced that brain fog from weight gain? Have you seen it lift after a health transformation? Let's talk about it down below. Next week, we are diving into a highly controversial new trial. Make sure your notifications are turned on so you don't miss it. Until next time, keep asking questions, keep reading the data, and take care of your brain.